Welcome everybody. My name is George Yu. I'm a urological surgeon specializing in cancer surgery. My area of expertise and interest was invasive bladder cancer. I won't be here today with you, but I hope we'll have more information for you next year. Before I start, I'd like to tell you about the ongoing study that we have called the Melanoma Breast Cancer Study. So far it's 1 year old. We have candidates, but we need more candidates and of course more funding. What we do is we are interested in patients and candidates who have breast cancer, melanoma, whether it's a fresh or failure, who want to use a dietary approach. We study their microRNA, which are markers of tumors, and also we get a biopsy of any skin lesions. Therefore, the candidates that we're looking for are candidates with melanoma and breast cancer who have skin lesions. By next year, we should have plenty of data to show you. What's interesting is that even within 4 weeks, we can see a gene expression changes. So the food you eat, the environment that you have affect your gene expression tremendously. So, since 2002, February 25th, at the NIH, where we took Dr. Larry Cushy's data on 300 cases of caloric restricted diets using a macrobiotic diet, we presented 6 full cases to a panel of 15 in which there was unanimous agreement that the food had a large effect on these patients. Some of these patients are still alive. Now, since that time, I have done audits on multiple institutions such as the Hippocrates Institute, Optimum Choice, Optimum Health. And what is interesting is they all have a common denominator. They have a common result. Number one, they all eat about a 1,200 to 1,500 calorie diet daily. They eat nutritionally dense food, which are easily digestible. They lose about 10% of their weight in a very short period of time of 3 months. Now remember, the food has variety, texture, flavor, and volume, so you're not starving to death. In fact, after your third meal, which I personally witnessed, your hunger is diminished markedly. In these patients and candidates and visitors, we noticed that their blood sugar in a fasting state is around 85 to 95. Their urinary ketones are up. And on the CAT scans, they usually have a picture of what I call visceral defatting, or the visceral fat is gone, and at the same time tumor regression and shrinkage. What's interesting is if there's dietary abuse before a 5 months period, they will have a recurrence. And we have seen this in a classical case of a lymph node palpable after they have gone off the diet. And it goes back to nothing when they resume a low-calorie diet. But what is most disturbing is that you would love to see a complete successful results, but a third of the patients will do very well. In fact, some of them are cured. But 2/3 will do well initially, and then later on they will fail. We also know that long-term caloric restriction has its own problems, such as bone osteoporosis, and also muscle wasting and hormone changes. In fact, you people are practicing a form of caloric restriction. Whether you do raw food, whether you do cooked food, all these organizations have one common feature. They lose weight and they eat low-calorie diets. But the history of caloric restriction has been around a long time. It's 70 years old. Animal studies are abundant, and I have, if you wish, you can ask your administrators to give you the bibliography on caloric restriction and caloric restriction in cancer. What is interesting is that the greatest human study done was in 1998 with Dr. Roy Wolford, who took 8 people in Biosphere 2, 4 men and 4 women, who were confined for 2 years using a 1,500 calorie diet and even down to 1,200 calorie diet. What's remarkable in this very short time, all the parameters that we use to mark disease, biomarkers and physical markers such as blood insulin, sugar, blood pressure, and lipid profile, all revert to a very virgin normal state. Now, what we have seen is something that is remarkable in the clinical world. For most clinicians and basic scientists, our greatest hope was in 2005, the beginning of the Cancer Genome Atlas Project. Obviously, if we believe in the somatic mutational theory of gene changes in the DNA, we can categorize everybody, and then we can find the mutations and thus the treatment to go against these changes. However, what's happened is, after all this work and all this money, we have not seen useful, consistent mutations, both in many cancers, from colon to pancreatic to breast cancer to glioblastoma. So what do? Nobody knows for sure. But what is happening is a change in the paradigm of how we think about cancer. What is interesting is that there is a tipping point and a paradigm shift slowly. The tipping point was coined by Malcolm Gladwell, and I think we see this in every field. What is very remarkable is, because of the somatic model of cancer has not panned out, so to speak, as well as we expected, there's an emerging concept of the metabolic model of cancer growth. And this is not new. However, an important book that came about by Thomas Seafield shows that it is a comprehensive, long study of the metabolism of cancers. What's more remarkable for us clinicians is that we use PET scans every day. But what is a PET scan? Basically, it's looking at the sugar uptake of cancers. And remarkably, 85% or even more of cancers all use lots of sugar. Cancers seem to ferment. They use glycolysis rather than an efficient oxidative phosphorylation. The 2 terms that you need to remember from this lecture is glycolysis means fermentation, and that's what cancers do, and oxidative phosphorylation, which is related to the Krebs cycle, and all you need to do is remember the Krebs cycle is inefficient or changed. What is interesting is, I'm going to show you a PET scan of a woman who came to our office who had memory loss. She did not come, but her daughter was our patient. And we gave her a small dose of Exona, which is caprylic acid, a fatty acid. Within a month, she brought her mother in saying that the Alzheimer's gotten better. But when we went to do a PET scan, we found a glioblastoma. She actually got better in 1 month, being able to do crossword puzzles and speak properly with a decent memory just from that alone. It was very, very impressive. But all of us clinicians are looking at PET scans every day, and we can't deny this phenomenon of cancers eating up lots and lots of sugar. There are people that I associate with, such as Peter Peterson at Johns Hopkins and Dr. Yang Ko at University of Maryland. There are people like Thomas Seafield, who wrote this book in Boston College. There are people like Dominic D'Agostino at University of South Florida. And there are people who've been thinking about this, such as Dr. Merrill Garnett looking at the palladium alpha lipoic acid. And there's a foundation by a young man named Travis Christofferson called Single Cause for Cancers. There is a movement from the standpoint of the industry of medicine is not occurring, but there's clearly some upheaval in the intellectual and research world of cancer biology. I believe after 11 years of following many institutions that use a calorie-restricted diet or nutrition with dense nutrition with weight loss is a form of starving the cancer cells. Dr. James Watson coined this as the Achilles heel of the cancer cell, blocking its energy derivation. For me, I believe that using a caloric restricted diet of 12 to 1500 calories or a form of caloric restricted diet with ketones, fatty acids, disrupts the mechanism in which the cancer cells can survive. I also believe that by gradually using both systems of eating properly and cycling it, and then adding these molecules such as 3-bromopyruvate would enhance the effect. Remember, I told you that about a third of them do very well, but the other 2/3 eventually die. There's an urgency in this message, and I believe that the conjunction, the union of using calorie restriction, ketosis, and molecules such as 3-bromopyruvate could block gradually the survival of cancer cells through its metabolic system rather than a DNA mutational approach. Recently, I received a nice piece of work by Travis Christofferson from the One Cause Cancer Foundation. And he quoted in there, which I like, Albert Einstein said, "Sometimes it's the simple reason that is the correct one." And I end this encouraging you to have a good meeting, but thinking broadly about what you're doing is a form of starvation of the cancer cells. Good luck and goodbye.